So I first saw a version of this tweet that made me laugh a few months ago. Quote, workers in Europe, I'll be taking the summer off because I need a little suntan. Workers in America, I'll be using one of my 3 paid vacation days to undergo open heart surgery. But don't worry, I'll keep my phone on during the procedure. And I couldn't help but think of that tweet again as we see how our leaders are reacting to getting COVID right now. On Monday, Senator Joe Manchin tested positive for the virus, and his response? Well, he's got mild symptoms, he's going to isolate and, quote, continue to work remotely to serve West Virginians. Got COVID? Keep working. We saw the same thing last week in the White House. We saw their social media response to President Joe Biden testing positive. Just hours after the announcement, Biden tweeted this video message.
Hey folks, guess you heard this morning I tested positive for COVID. But I've been double vaccinated, double boosted, symptoms are mild, and I really appreciate your inquiries and your concerns. But I'm doing well, I'm getting a lot of work done, I'm going to continue to get it done, and in the meantime, thanks for your concern.
Good to hear that after testing positive for an illness that has killed over 1 million Americans, the president is powering through it. No time off for him. I mean, just look at these pictures of the president. Just a day after testing positive, he's smiling and hosting a virtual conference. Here are some more. The president and White House accounts showing us how Biden is continuing to work away and, quote, keep busy. Now, to be fair, he is the president. There is a lot of work to be done, and in a way, he does need to project strength and leadership, even in a crisis, a health crisis, especially when the right is always criticizing him for appearing frail and weak. I get it. But at the same time, what kind of example is this setting for ordinary workers across this country? Gone are the days where COVID was an illness that prompted people to take some time off of work or be allowed to take time off of work. The new message is power through the virus. You shouldn't let it stop you from working. It's not just being implicitly suggested, it's explicit. The day Biden tested positive, White House Chief of Staff Ron Klain retweeted an article from Washington Post columnist Dr. Leana Wen, a column that reads, quote, Biden should use his illness as an opportunity to inform the public that COVID-19 is a manageable disease for almost everyone, so long as they use the tools available to them. Wen also writes, another key lesson is that it's inevitable that everyone, even the President of the United States, will be exposed to the coronavirus. Biden is back at work and carrying out all the duties of his office. That's exactly as it should be. Easy peasy. Everyone's going to get it. This is exactly as it should be. We have the tools anyway. The problem with this thinking is that it's coming from an ivory tower. As Dr. Wen also notes, Biden is on the antiviral drug Paxlovid, and the sooner someone takes it, the better. I hate to break it to you, but it's just not that simple. Some patients and even doctors say it can be very difficult to get their hands on Paxlovid. In fact, even the CDC recognizes that what's good for President Joe isn't necessarily good or required for the average Joe. Have a listen to this exchange with CDC Director Rochelle Walensky from Friday.
The White House has pledged to go beyond CDC guidance in caring for President Biden. For example, to make sure that he stays in isolation until he tests negative. If the White House thinks that's the right approach for the president, shouldn't that be the right approach for all Americans?
Yeah, I think we can all agree that the president's protocols likely go above and beyond and have the resources to go above and beyond what every American is able and has the capacity to do. We also put in the option to go ahead and get a test. Not everybody has access to them, but to go ahead and get a test.
So basically, many Americans don't have the resources to be able to follow the kind of protocols the president is following. They may not even have access to tests. So no need to isolate, carry on working. In fact, it goes beyond being able to just get a test or isolate. Millions of Americans don't even have health care coverage. In the world's richest country, there are still around 30 million Americans who still don't have any health insurance. And according to the US Department of Health, not only are many of them from communities of color, it's in large part because, quote, health coverage has been perceived as out of reach because of cost. And for those who do have health care, taking paid time off from work to recover can be a nightmare, if not impossible. Just look at how the US compares with other wealthy countries. When the pandemic started, we were the only wealthy nation without mandated paid sick leave. That's the US there, at the very bottom, 0.0. Today, if you're lucky, there are some employers who allow employees to take time off if they're sick with COVID, and some have adjusted their own internal paid sick leave policies. But that's it. Nothing radical and nothing at all coming from the federal government. For all the talk over the last 2 years about our failing healthcare system, about huge inequities and disparities in health and access, and the urgent need to address all of this, we have not changed. We should get back to normal, people say, even though pre-pandemic normal was pretty bad. And the new normal looks even worse, given the President of the United States is saying, I'm sick with COVID, but working hard, keeping busy. And his chief of staff is sharing articles that say you should be okay with getting COVID multiple times a year, despite the fact that millions of Americans don't have paid sick leave or even access to basic health care. What kind of message does that send to millions of Americans who are seeing COVID cases and deaths on the rise again? What kind of toxic work culture does that reinforce in this country? And how is it that Democrats, not Republicans, Democrats are the ones pushing this dangerous and frankly cruel approach? Joining me now to discuss all of this are Dr. Kavita Patel, MSNBC medical contributor and former health policy director in the Obama White House, and Dr. Rob Davidson, an emergency room physician and executive director of the Committee to Protect Healthcare. Thank you both for coming back on the show. Kavita, let me start with you. The president is given COVID protocols that are above and beyond what the CDC recommends for ordinary Americans. What kind of message does that send to ordinary Americans?
Mehdi, it sends a message that the protocols in place that the CDC makes, recommendations, guidance, et cetera, are simply not good enough for our nation's leader. And by the way, not just our nation's leader, for much of the White House complex. Nothing makes me cringe more than when the CDC removed masks in May of 2021, prior to, as you know, many of the surges that we've had, including Omicron surges. And on top of that, changing over the last 6 months, where there's basically no recommendation to test at all, and that you can just, quote unquote, wear a high quality mask and, quote unquote, as the CDC director said, if your symptoms have improved. Mehdi, last I checked, that's actually why I went to medical school. It's why Dr. Davidson went to medical school, is to help people walk through. Did their symptoms improve? Have they been able to effectively isolate? And to your point, patients have begged me to not test them because they're worried that if they're positive, they can't go to work, to your point. They don't have paid time off. They can't take that time off. And so it sends a message not only of elitism, reminds me of that West Wing episode where nobody knew what the price of a gallon of milk was. This is essentially what we're saying. President should have different protocols. He is different. He's not like the rest of us. But if those protocols are good enough for the president, they should be good enough, because we're practicing science. It's not subjective what we're doing to the president. It's our best science.
Rob, we mocked Donald Trump when he went on about, remember when he came back from the hospital in 2020 and said, don't be afraid of COVID. And a lot of us said, well, easy for you to say. You had the kitchen sink thrown at you in terms of treatments. Obviously, that was a pre-vaccine era. Joe Biden rightly points out he's double vaccinated, double boosted, so he's milder symptoms, but he is getting better health care than everyone. Rightly so, he's the president. But the idea then that everyone should just be relaxed, that the White House chief of staff should say, hey, everyone, deal with COVID. Joe Biden's dealing with COVID. It's just the wrong message, is it not?
Yeah, I mean, I will tell you, 2.5 years I've been working in the air this whole time, and I haven't gotten COVID. It's because I do wear high-quality masks when I'm in public spaces. I do follow the protocol, and I'm double vaxxed, double boosted like the president. I think it's a challenge, though, if we were to enact guidelines that the White House is following for President Biden, just like Dr. Patel said, and like you said in the open, we don't have policies in this country that allow workers to take that amount of time off. I have people who have to come in, pay a big copay to see me to get a note so that they don't get points taken away. They have a point system at their job. And if they get too many points, they can be reprimanded, they can be terminated. And so it's just such a backward system. It's so barbaric to require people to go see me when they're maybe not terribly symptomatic. They could simply isolate at home. And then when I tell them they have to isolate for 5 days and then go out wearing a mask 5 days after if they're better, they say, well, I don't think I can stay away from work that long, because those points will start to accrue and I may lose my job. It's barbaric.
Yeah. And it is, as you say, such a backward system. And yet, Kavita, people who should know better are fine with it, in a sense. I mean, what is your response to Dr. Leana Wen, the Washington Post columnist, former president of Planned Parenthood, saying in her recent piece that we all just need to get used to getting COVID multiple times a year, that we have the tools for it, that this is a teachable moment, and then seeing White House Chief of Staff Ron Klain approvingly retweet her piece?
I think that's what really kind of set me on fire, was that we're endorsing, look, Dr. Wen is entitled to her opinion. She's not trying to actually take care of patients on the front line every day like the two of us are on this panel, but she definitely can say what she wants. But for Ron Klain, the chief of staff to the president, who is undergoing treatment for COVID, to kind of endorse that, number one, it goes against the grain of science of what we know now. There is a significant body of research that shows, Mehdi, that with repeat infections, we are actually accumulating, increasing our risk of mortality and morbidity. Those are real numbers.
Yes.
That it doesn't even, it trivializes long COVID. We know that vaccines can help with long COVID, does not eliminate that risk. And I can tell you right now that that is going to be the kind of chronic disease of our time that not just defines our generation, but future generations. It's already crippled millions across this country. So long COVID is a reason not to get infected, not to mention, Mehdi, public health, epidemiology, microbiology 101. We do not want to give this virus so many chances to mutate by just saying, come and get us. Let's just take on and have as many infections as possible just because we have treatment. I don't invite people to get coronary artery disease just because I have treatments for them. I think that just sends the wrong message from prevention and public health.
It's so true, and I'm glad you said that, because reading some of Dr. Wen's columns have driven me up the wall. And also, Kavita, there's been an obsession, even among many liberals and elected Democrats, to get back to normal. Even though normal was pretty awful when it came to our healthcare system, the lack of universal healthcare, our work practices, as you and I have both mentioned already today, the lack of paid sick leave. I mean, it was bad in 2019. Surely it's worse in 2022.
It's worse in 2022, especially when you have people who are, we have more and more people that are in a gig economy, don't get standard benefits, are literally living, not even, Mehdi, not paycheck to paycheck. They would love to live paycheck to paycheck. They're living side hustle to side hustle, trying to do what they can, not to just feed themselves, put food on the table, but American mobility. Not to mention 70% of people who have paid family leave are white. So we have communities of color that have been left behind, and all we are doing is going backwards. We are taking away gender-affirming care. We're taking away reproductive rights. I wish I could go back to 2019. And so this new normal is far worse than I could have even predicted prior to COVID.
Yep. And Rob, one last question to you. You work in an ER. What have the last 2.5 years been like? What's it like right now with COVID cases going up again? I feel like I'm losing my mind when I hear people say COVID is manageable right now, given there's still hundreds of daily deaths, the impact of long COVID, as Kavita mentioned, the burnout for doctors and nurses.
Yeah, I mean, folks like Dr. Wen live on the coast, live in places where many people are vaccinated. I still work in a place where about 50% of people are not vaccinated. I took care of a person in their 90s yesterday who didn't get the vaccine because her family told her that it might hurt her. And she's ended up getting admitted to the hospital with low oxygen with COVID and has an uncertain future now because they listen to disinformation. And so I think it's easy for folks like Dr. Wen to sit on the coast and say these things when those of us in the middle of the country and the vast majority of this country are still fighting disinformation, still fighting this virus, without the tools we need, because our patients just are listening to the wrong news channels, frankly, and the wrong people in power.